and the perirenal area as the ovaries in the female. So all these sex changes, they are also going on. So at this time period, we have seen there is the quickening, the vernix caseosa, brown fat has formed, the genitalia has been more differentiating. Then still going on 21 to 25th week, the weight gain is increasing normally, which just was just the length size was increasing. Then now the weight has started to increase. Skin is still wrinkled because your subcutaneous fat is not developed as yet and it has not been laid down. So it is the skin is in a wrinkled form. It is not stretched because of the deposition of the subcutaneous fat. Eye movements can be felt. Then the important structure that is to develop in this is your surfactant, that is type 2 pneumocytes. This surfactant is produced by the lungs in the type 2 cells. This is that it prevents the alveoli from collapsing. Before this, the baby cannot survive because the surfactant, the alveoli or the air passages, they cannot be patent. So in this stage, that is from 21 to 25 weeks, the surfactant has started to form. So that is why if the good care is done, baby is born at this week level, may survive because the surfactant is there, which is a very critical thing for the baby to, otherwise the baby will suffocate there if it is not there. Fingernails start to form, right? So these are the important thing in this stage is that the surfactant, the alveolar walls of the lungs begin to secrete the surfactant. So if intensive care is given, the baby may survive, but still the respiratory system is immature. So 21 to 25 weeks, your respiratory system starts to function, produce surfactant. From 26 to 29 weeks, baby may survive if again intensive care is given because your lungs and pulmonary vasculature is developed and your surfactant is being produced. CNS is matured at this level, so certain amounts of breathing can be controlled. There is a balance between the respiration and the central nervous system. The highest neonatal mortality occurs in infants of low and very low birth weights. If the weight of the baby, growing baby, is in the normal, that is the mortality rate is going to be slow. Eyelids open, languor hair well developed, that is the toenails visible, considerable subcutaneous fat. That what we said was the skin was wrinkled because of the deposition of subcutaneous fat. Your skin would become smooth out, and spleen, liver shifted over to spleen for the production of the blood cells. But now at this stage, 29 weeks, spleen shifts over to the bone marrow to become the major site of this process. That I told you when we talked about the third to the eighth week when we were talking about the vascular and the angiogenesis. So now gradually first the liver, then the spleen, and now at this stage, 29th week, the bone marrow takes over the formation of the blood cells. This is 30th to 34th weeks. Pupillary light reflex can be seen. Skin is pinkish. Upper and lower lips become more rounded. And from brown fat, white fat is approximately 8%. They say this have started to appear. The white fat, which is the normal fat in the body, and they say at this stage, 34th week, if the baby is born, it can prematurely, it can survive. Then 35th to the 38th week, spontaneous nervous system is sufficiently mature to carry out some functions. Fetuses become rounded. Circumference of the head and abdomen are nearly equal. By full term, most fetuses reach a crown rump length is 360 and weight approximately 3,400. We said till 2,500 was a premature age, but if good care is done, baby can survive. But the baby has to reach 3,400 grams to be a normal baby. White fat increases. Fetus says at the end increases by 14 grams of fat per day during these last weeks of gestation. Right? So that is to increase the weight and to become the giving the rounded contours of the baby. And male fetuses are longer and weigh more at birth than females. Or thorax, chest, all these features they develop. Testes are fully developed in the scrotum. They have descended to their normal position. If a baby is premature, these testes will be undescended. The one of the most striking changes which take place in the fetus is slow down of the head and the growth body accelerates. At third month, yet as you see, the face becomes more human looking like. So that was about all how the at different time period we have the different things which are developing. Now, if we collectively take it month wise, as we repeat, the most important feature was that the head became slow in growing and the whole body is going to grow. By the third month, the face becomes more human looking. Eyes, as we've said already, move to the ventral aspect, which were more laterally placed. Ears come to lie to the side of the head, and rims reach their relative length more in the upper limb. Lower limb are still a little bit disproportionate. Primary ossification center is present in the skull, and external genitalia can be differentiated by ultrasound during the 6th week. Intestinal loops were large swelling, then they come back. Herniation, as we've said, they come back into the abdomen, and reflex activity can be evoked in aborted fetus, and they say that means that some muscular activity has also developed. So by the first trimester, all these things can be elicited. That means these features have to be there by the first month. Then during the fourth and the fifth months, the fetus lengthens rapidly, and at the end of the first half of the intrauterine life, the baby is growing quick. The crown round clamp increases, weight of the baby increases, but still it is less than 500 grams. Increases still less than 500 grams. Fetus is covered with fine hair, because we've said at the end of the trimesters, last beginning of the birth which is there, then again there is going to be a maximum growth of the weight of the baby. The fetus is covered by the lango hair, eyebrows are there, movements that is quickening can be felt. That is in the fourth and the fifth month. In the second half of the intrauterine life, weight is going to increase, and that is going to still about 50% of the full weight, which we say it is 4,500 grams. The baby at the level of is roughly second to third month is 3,200 grams. 6 month where the skin is reddish, has a wrinkle, difficulty in surviving. Several organs able to function, respiratory and central nervous system have not differentiated as yet. No coordination between the two. And by 6th to 7th month, if born at this time, the infant has, by 7th month, the infant has a time to survive. In the last 2 months, that is 8th and 9th month, the fetus obtains rounded contours. At the end of the intrauterine life, the skin is covered by the vernix caseosa, and end of the 9th month, the skull has the largest circumference of all parts of the body, an important fact with regards to its passage through the birth canal. That is what I told you. It is the assessment of the biparietal diameter that has to be taken for granted to see if the baby is going to be passed normally or not. And at the time of birth, the features are the weight of a normal fetus is 3,000 to 3,400 grams. Its ground round length is about 36 centimeters, and its ground height heel length is about 50 centimeters. That is the normal features here. The characteristics are well defined, and they can be differentiated, and the testes they have descended into the scrotum. This is exactly the picture of the baby in the third month. You see big head, disproportionate size of the limbs. Then in the umbilical cord, you can see the herniation of the intestines that has returned back by the fifth month. The size of the head has decreased. The limbs have become more proportionate in their length, well developed. And then at birth, you can see a rounded body, full body. Head has become small. Hair have developed first. There were no hair. Then the nose is there, ear have ascended from a low set level to a higher level. The eyes have reached into the midline. Then the abdomen size has increased, and it is rounded contours. And this is after 9 months, a healthy newborn baby that is there, which is an active baby, full protuberant abdomen, hair are there, all the normal arrangement or the point features of the baby are there. That is the end result of all what is going to occur after the development of the features. Then what is the expected date of delivery? The expected date of delivery, we say count, start to count the date. As we said, from if your last menstrual period is going to be 280 days or 40 weeks, and if it is 2 weeks after, that is when the fertilization occurs. That is 266 days and 38 weeks. So that can be both ways. Approximately 12% of the babies are born 1 to 2 weeks after the expected time of birth. That is because the mother cannot estimate the time period or the periods or the cycles, or the estimation is slightly wavering of the estimation of the time period. So that is why the it may be up or below. Baby born much earlier is premature, baby born later is post mature. Right? That is the term that is used. Now, in gynae, the common delivery date rule is Negli's rule for estimating the expected date of delivery, because it is 9 months and the year has 12 months. If you count 3 months previously, that way you can count your expected date of delivery, or you go uh, from 3 months from the first day of it, or add a year, or you go 1 year ahead. That's gynae, you will not understand. That is the Negli's rule is the way to count the, because you are then going forward from ninth month. So when you are supposing it is third month and you add 9 months, it is you're counting a year ahead. So you go on to next January. And if you count it this way, you go 3 months backwards. That is you're minusing 12 from 3, and then you go on to 9 weeks. So that is the what is the rule that is called Negli's rule. Now, a valuable tool for assisting in this determination is ultrasound. That is the only helpful machine which tells how old is the baby and what are the different features, which can provide an accurate 1 to 2 days measurement of crown rump length during the 7th to the 14th weeks. Measurements commonly used in the 16th to 30th weeks are biparietal diameters, we repeat, head, and the abdominal circumference and the femoral length. The ultrasound machines, they have inbuilt measurement schemes that measure the biparietal diameter, head, abdominal circumference, and the femoral length. And then with that, certain meters, the estimation has been done that at this age, this length, the baby is supposed to be of this size. An accurate determination of fetal size and age is important for managing pregnancy, because that is what I said. If they consider that the fetus is premature, you try, and still there is time period, you allow 1 week, 2 week more, or some more time period, so that the fetus develops more and you are more having a stable baby. So that is an accurate determination of fetal size and age is important for managing pregnancy, especially if the mother has a small pelvis. That is, I said, head has to pass through the birth canal, and if the pelvis is small and the baby has a birth defect, all these factors have to be considered, whether to give it a normal birth, whether to wait for it, whether to go for a C-section. So all that is done by the measurement of these factors. What is post then is post maturity syndrome. What exactly is when you label a child as post mature? It's not everything that if the you have said your date is 1st January, and if the baby is born on 2nd January, you say that it is a post mature syndrome. There are certain features which label a child as post mature. Prolongation of the pregnancy for 3 or more weeks beyond the expected date of delivery occurs in 5 to 6% female. Develop the post maturity syndrome and have an increased risk of mortality. More than this, just 1 to 2 weeks or is enough, but if it's more than 3 weeks, it is said to be called as a pre and post maturity syndrome. They have a chance, and they have a chance that the baby might die. Risk of increased risk of mortality, keeping the baby inside. Because of this, if the mother doesn't start labor herself, then there is an induced labor. That is, they give medicines, they give a drip, and they start the labor itself, so that the baby doesn't go in a post-mature stage and giving a risk to the baby. They deliver the baby themselves. The features that you see in a post-mature baby is, even if the mother has no idea about the exact dates and assess the dates using, that the baby is post-mature, the mother says, no, my date is still far behind and I can go on for another week. It's not going to be post mature, but all these factors, when you see on the baby, you can label that baby as a post mature baby. The fetus, the skin becomes dry, parchment like जिसका चमड़ा होता है ना लेदर उस तरह हो जाती है एक पोस्ट मेच्योर बेबी को जब आप डिलीवर करते हैं. Often overweight because the baby is going to increase, he is going to be fed on, and it's going to be an overweight. It has no lengo, वो खत्म हो जाते हैं बाल. Vernix caseosa production decreases, long nails हो जाते हैं, and increased alertness. The baby becomes very alert, the movements are hyper, and the skin is dry. All these factors are seen, and then you then label them as a post mature syndrome, or it is a post mature baby. Now, next time we'll talk about the factors influencing the fetal growth. I hope, and what are all the tests that we do for labeling or which can help in the delivering the baby, how we can find whether the baby is normal, whether there are abnormalities. So this is post maturity syndrome. Then we talked about how can we expect the delivery date, how can we form, what can we for it to follow it. Then what are the different features which are going to occur in the development at different stages, different weeks, different abnormalities can be assessed in different weeks. First, at the ninth week, you could see this first picture, then gradually the baby is going on to a normal position. All the features are going to a normal level. The limbs are going to go to the normal proportions. See this in all structures. Then what are the helpful criteria? That is biparietal diameter, head circumference, abdominal circumference, femoral length. All these, they help in measuring the baby's growth. So that was about all. Next time, inshallah, we'll talk about what are the features which can lead to the influencing fetal growth. What can play a role? Okay, ji. Thank you.